Hi, I'm Dawn Patrick with Cherry Bekaert. We are CPAs and advisors who focus on serving innovative and growing middle market companies throughout the US. So today I'm here with Chase Spurlock, CEO of Decode Health, to hear a little bit about what they do, how they've adapted their business over the last few months, and what keeps them committed to their mission. So welcome, Chase. To start us off, tell us about Decode Health.
Well, Don, first off, it's great to be with you, and I really appreciate the invitation to join you for 3686. So I'm Chase Spurlock, founder and CEO of Decode Health. My background's actually in healthcare and healthcare data science applied to chronic disease. And Decode's the second startup I've led where predictive analytics are at the core of our approach to identify as early as possible undetected, misdiagnosed, and uncontrolled disease. And we're capable of deploying Decode's solution across very large populations. We've been working for many years in the chronic disease prediction space, and what we find is that all too often healthcare is reactive. And at our core, we predict disease outcomes and disease trends that enable proactive disease management. So using all the tools at our disposal, we identify specific patient personas that lead to specific disease outcomes. And our goal is to provide insights to care teams months in advance of some adverse event, or to spotlight patients who are trending towards a diagnosis. We've also been able to use our approach to pinpoint misdiagnosis, which unfortunately is all too common despite everybody's best efforts. And this chronic disease framework we've built over time can be applied broadly to many disease areas, like autoimmune conditions such as MS and Crohn's, or other chronic conditions like COPD, diabetes, hypertension, and even chronic kidney disease.
That's really important work, really important. So, so what is your founder experience made you realize about yourself and your organization or your industry? Because you are doing some things that are critical, especially as we see kind of what's happening around us in the healthcare world.
Yeah, so I guess focusing on what I've learned, there's a certain thrill associated with being in a startup, and you live for the small victories, and you live for the people that are around you on this journey. But I would say my single greatest support in this journey, and one of my defining founder experiences, has been recognizing the importance of the people that are around me, and people like Julia Polk, who co-founded Decode alongside me. Startups are really a family. And if you don't have that, you need to focus on your culture, and because it's going to carry you. And there are times you'll feel as though one day you took 2 steps forward, only to find that the next you took one giant step back. And it's those people that are around you that are important. And you find that while the mission and vision of the company are critical, it's the people that carry you throughout the day.
Yeah, absolutely. Team is extremely important. So I guess lastly, we've all obviously been impacted by COVID in so many ways. So how has this impacted your business, given that you're in healthcare?
Well, there's a lot to say about this. And COVID certainly has led to a lot of uncertainty, whether you're a large company or a small company. I think COVID has forced everyone to be more conservative and focus on the things they need to do rather than the things they may want to do. But despite it all, I honestly believe we're living in a situation that's a golden opportunity for healthcare to reimagine itself and to turn a negative situation into a positive one. And people are taking an interest in their healthcare now more than ever. Virtual medicine is proliferating at a rapid rate, and companies are craving the crystal ball that analytic solutions like ours can deliver. And so for us in this COVID-19 era, we recognized very early on that there were certain areas in the country that had a higher propensity for emergence of COVID, and certain areas had a higher risk profile for poor patient outcomes like hospitalizations or death. And one of the defining features was actually a link to chronic disease. So our past world in many ways collided with the current pandemic. And what we've done is we've leveraged our existing framework to model evolving COVID risk using all of the skills, data, and disease knowledge we've put together previously. And what that's allowed us to do is to predict COVID at a national, state, and community level, and to track new COVID cases, to track COVID-related deaths and hospitalizations, so that we can provide targeted information to decision makers. And working with these new partners, we're focused on 3 areas that are key as we think about putting students back in the classroom and having businesses reopen the doors, and also providing health officials with the information they need to get ahead of COVID spread. And the first is population screening, focused on school and employer risk assessments that allow us to assess in real time the likelihood for COVID across often large populations. This can be for schools that are K through 12 or in the university setting, or in employers big or small. We can track and predict emerging trends for the population we're serving. The second is contact tracing efficiency. We can accelerate the notification process. We can also deploy these enhanced mitigation efforts for future cases to be able to slow the spread of future cases. And it's these data on the close contacts and from these contact tracing efforts that can provide a rich source of information to pinpoint emerging hotspots. So just like the population screening, knowing who these people that may have been exposed or who are likely a COVID case, who they've come into contact with in the community, can help us map out COVID spread. And then the final piece of this is testing center efficiency. So speeding up the intake process, which unfortunately is very manual. It's a handwritten process. And this manual transcription has led to the need for increased staffing and a lot of extra costs. But the questionnaires that are performed at the time of testing are a rich source of information before the lab results are known. And we've adapted a mantra these days. Our goal is to deliver answers before results. If it takes 7 to 14 days currently for all the information to be collected and lab results reported, we're too late. So we made the conscious decision to work with those upstream, like the testing centers, to be able to access the information at the point of testing and to be able to feed the insights that we generate to the community leaders so that they can track emerging hotspots ASAP.
Chase, thank you so much. I really appreciate all your insights and all the great work that Decode is doing. It's very important, obviously, and really just appreciate you taking the time to talk to us about where you're headed, and just thank you and continue the important work that you're doing.
Okay, thanks so much.